Good evening. The special meeting for the Rancho Board of Education for Tuesday, November 10th, 2020 is now called to order. Please all arise for the Pledge of Allegiance and mute your microphones. Vice President Morgan will lead us in the pledge.
Good evening, everyone. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much, Vice President Morgan. Jane, can you please take a roll call for us?
Yes, I will. President Galbraith?
Present.
Vice President Morgan?
Present.
Secretary Scott?
Present.
Board Member Cullen?
Present.
Board Member Coleman?
Present.
Thank you.
Thank you, Jane. We have a quorum present tonight. We'd like to welcome everyone out to our board meeting tonight. We'd like to welcome our staff who is with us and also our teachers, our families, and those who are members of the community who are tuning in through YouTube tonight. We're excited to hear from Dr. Mitchell here in a few minutes and grateful that he was willing to come onto this meeting and speak with us tonight. To get us started tonight, we will first hear from Dr. Visu Cleveland, our Superintendent of Schools.
Okay, good evening, everyone. Thank you so much for being with us, and we are looking forward to having Dr. Mitchell join us. Hopefully we're not having any technology problems with that. But I would like to do just some general remarks before we get started, and so maybe some of the things you've already heard, but just kind of a review that kind of leads into the discussion this evening. Okay. Again, thank you for being here. We've talked with you a little bit about the fall learning survey that was being sent to students and parents and staff. And so that survey information is back, and so it will be presented to you next Monday at the regular meeting. And we will provide you a copy of the survey. It is TNTP, and our staff will share with you the feedback. We wanted to get some independent survey instrument and to get that feedback to see how we're doing this fall, and again, use that to improve our services. We were very, very pleased that we had a good response to the survey from various audiences, and so I think we've got good information to share. And as I said, it'll help us with our own continuous improvement efforts. And as you would probably expect, given all of the issues that we're facing today, there were a lot of differences of opinion and even sometimes some mixed messages, but still very useful data. We have a second survey, so not to be confused with the first one. It's the Community Travel Survey. And so we are in the process of collecting information about travel plans for the Thanksgiving and winter break. We had a lot of emails. We have had a lot of conversation with staff. We thought we really need to get the data. And so we sent it out. The survey is still open until Wednesday. So if you've not participated, there is still plenty of time to participate. It will close tomorrow afternoon. And we really hope that staff and families will respond, because it gives us the information we need to be able to plan for return to school after the 2 holidays. As of right now, we're very concerned there will not be sufficient staff to operate the schools due to quarantine requirements. And so, and we certainly have had a plea from the state that said, please encourage people not to travel over the 2 holidays. There's really no way we can do that. No way we can force people not to travel to see their families. And in some cases, people didn't travel other times, and now it's been quite a long time since they've seen some of their families. In addition to that, many of our families have people coming to visit them over the holidays, and some of them are coming from high case states. Right now, for example, just to give you, and again, that it's not closed, but as of right now, we have about 40% of our students and staff who plan to travel over Christmas or have families coming to visit them. And there's just no way with quarantine that we can cover those classes. We don't have that kind of substitutes, very few substitutes right now. Next slide, please. Thank you. I want to just give you a little bit of COVID-19 update from the district, just some positive considerations. When students in the hybrid model do continue to do well, we've had a lot of positive comments coming back from the survey about hybrid learning. Most of those are positive. We continue to have some challenges with remote learning as well as in-person learning. There's still a lot of things that we've had to learn to do differently than we've done in the past. As you might expect, the parents in grades 4 through 5 feel very strongly that the 2 days a week for them rather than the 4 days for K through 3 is not enough. But with the socially distancing requirements and the number limits that were put on each school, it is impossible to bring grades 4 and 5 back for 4 days a week. We wish we could. If we had the room, we could space them out, we would, but we can't. We continue to get a lot of questions about when we'll be bringing our 6 through 12 students back into a hybrid learning environment, and we've been told that is not anticipated to happen in the near future at all. We are waiting for a toolkit on re-entry for secondary students. We've been told that we should get that in the next couple of weeks, which we'll talk about how we will do that. And yet even with that, they said we should not anticipate that we would be bringing them back in the immediate future. Okay, next slide, please. Positives, other positives. Our parents have been very supportive of hybrid learning, and they believe it supports their needs to have children in school. And they have indicated that they are choosing to send their children to school, and they understand the risk. On a positive, we certainly have no documented of cases of COVID-19 spread within the schools. I want to be very clear. That doesn't mean we don't have a lot of cases, and we have a lot of cases right now in the district, across the district. We've been working very closely with DOH to determine whether those cases came from outside the school or whether they were spread from within the buildings. And so far, we don't have any documented cases of it spreading, but that doesn't mean that that hasn't happened. For those of you who are very interested in knowing the specific information and the number of cases, the number of positive cases per campus, we have that. We believe in being super transparent so that you will see how many cases are actually out there in the buildings, and it's a significant number. Also, in terms of surveillance testing, we appreciate everyone who's participated that's been asked to do that. It's doing the job. We are identifying a good number of people who are asymptomatic but are positive. And we obviously don't want those people in the buildings. And so, again, to everyone who agreed to be tested, we really do appreciate it. Okay. Some of the challenges that we're facing, here's the bottom line for us. The district mirrors the community, and so when the cases go up in the community, they go up in the schools. There's just nothing that we can do to stop that, and the community cases are going up at an alarming rate right now. One of the challenges that we're having is some parents are not keeping their children at home when they're ill, and I just can't emphasize enough why that's a really, really bad thing to do, nor are they always following the quarantine guidelines. And so they've come into contact with a positive case outside of the school. They should be quarantining, and they're not doing that. And so usually we find out about this because other parents will tell on them, and they will call and they will ask for us to step in and do something about that. And we do. And so we have to force that issue with individuals who are not following the DOH protocols. And then my last comment, and I've shared this with you before, is that contact tracing and quarantining staff and students is turning out to be a whole lot more work than we ever dreamed it would be. Identifying every person who's been in contact with a staff member or every child who's come into contact with another child, calling all of them and getting everyone to quarantine, it's taking hours and hours of work. And so we have been doing it. Staff has been working hard on it. We have people who are working 12 or longer hours a day, and they're working 7 days a week. We have some staff that have not had a break on the weekend for 5 weeks. So I just want you to be aware of the sacrifice that people are making to try to make sure we contact everyone who may have come in contact with a positive case. And then I'm sure you will hear from Dr. Mitchell. I saw he did sign on, so we're delighted to have him with us this evening. Our hospitals are reaching capacity in New Mexico as we speak. Also, it's not just outside the school. We have some issues within our own organization. We have had some staff members who've come to school ill. This should never happen. We tell people, please don't come when you're sick. You may or may not be positive, but don't come when you're ill. And we have found there have been some people who came and they were ill and they were positive. So we don't want people coming into the building. We now have some new guidelines on school closure requirements. Our schools must close if there are 4 positives within 14 days. We have 2 schools under these rules that we would have closed that did in fact have 4 cases within the 14-day period. And we have 1 school right now with 1 more case. We'll make it the 4 within that time frame, and we'll need to close if that occurs. Again, as I've said, we staff have put in a tremendous amount of hours, as has folks in other areas, certain DOH or our medical community. But it's just hard without a break to sustain that in the long term. And then, as I mentioned before, we are really looking at being almost impossible to staff if everybody leaves over the break, has to come back in quarantine. And so there has been a plea that's been issued for people not to travel. It's a dangerous time to travel, but certainly we don't make that decision for individuals and for families. Mike is very quickly going to share with you. We have had a question about quarantine for staff and what that looks like. And so I had a call from one of the board members saying, I don't understand why this person is quarantined for 24 days and this person was only quarantined for 14 days. And so there are several different factors. And I'm asking Mike Chavez just to go over that very quickly with you. And then we will wrap up since we have Dr. Mitchell present this evening. Mike, would you pick that up, please?
Yes, thank you, Dr. Cleveland. Good evening, Mike Chavez, Human Resources Executive Director. President Galbraith, Dr. Cleveland, members of the board, thank you for allowing me this time. Very quickly, there really are about 3 levels of quarantine. If an employee or a student should show up symptomatic, they are quarantined until, let me back up to staff members. Staff members are required to get a test, a COVID test. That staff member is quarantined until they can show a negative test and they have not had symptoms for 24 hours. So the number of days that they might be out varies depending on how long it takes for them to receive their test back, which lately has been up to 5 to 7 days. For a while there, they were getting them back in 24 hours. So it has gone up in time. The second, students are not required to test if they're symptomatic. They are, and I'm going to ask Joe Sanchez to please jump in real quick on the students, because I'll be perfectly honest, my brain is full and I do not remember how long students have to stay out if they are symptomatic.
Okay, so the quarantine period for a symptomatic person is 14 days from the onset of symptoms.
For students. Thank you very much, Joe. Because students are not required to test, and so therefore would have no evidence that they are COVID-free. The second type of quarantine would be a close contact case, and that would be when an individual comes into close contact with a positive another individual who's positive. It could be on one of our campuses, or it could be an individual that they know as a friend or a family member. This is someone who does not live in the household. If that's the case, They are required to quarantine for 14 days. A staff member would be, again, required to test within 7 to 10 days and would be required to show a negative test in order to return to work. Students, again, would be required to quarantine for 14 days. So close contact individuals are out for 14 days. Now, here's where it gets a little bit tricky. If you are living with someone who is positive, you must stay out at first for the entire time that positive individual isolates. And a positive individual must isolate for at least 10 days or until they are symptom free. That's the infectious period. And once that infectious period is over, it's typically around 10 days. It can be longer than that. So the close contact household member must remain quarantined for the entire time that the positive individual is infectious. Then the close contact household member must begin a quarantine period of 14 more days. And within those 14 days, after 7 to 10 days, must get a negative test and be symptom-free in order to return to work. Therefore, there is the potential that one of those individuals could be out for 24 or more days. Those are the quarantine scenarios. So that's why it varies greatly among staff. And again, as I said, some of our staff are having difficulty getting their test results back. We do intervene. If it's been a long time, we do reach out to the Department of Health, and we try to help the employee to get their results back. I did speak to the school health advocate today. If an entire building is quarantined, as Dr. Cleveland said, because there were 4 cases, she did confirm that there would be no access to that building, because the point of closing the building is to keep people away from each other. They are not quarantined necessarily because we've simply closed the building, but the Department of Health would like to mitigate the number of people coming into contact with one another. The problem with that is it does disrupt our operation here in the district, because we have many staff members who rely on those buildings for their internet access, as well as their materials and their transmission to their students. I stand for any questions you might have quickly.
Does anyone have any questions for Mike? Okay, we're good.
Would you go on to the next slide, please? Thank you so much, Mike.
Thank you, Mike.
And then I will close out with just a quick comment. Tomorrow certainly is Veterans Day, and we are closed across the district for Veterans Day as a matter of respect for those who have served. And we have a large number of our staff in this district who have served in the military. Some were career military before coming into public education, and others were not. We also have a lot of our students who graduate and go into the military from the Rancho School District. And so we want to honor all of those. And many of us have family members. I have many who have served in the military. So we thank them for their service. We honor them for what they have done for our country. Certainly Veterans Day was originally Armistice Day, the ending of World War I. And of course, the holiday always falls on November the 11th, because it was the 11th hour, the 11th day, and the 11th month when the armistice was signed. And then in 1954, under the direction of President Eisenhower and former Allied commander, that it was changed to honor all of our veterans, regardless of when they served. So we honor them and we thank them. And I wanted to certainly make a note that tomorrow is Veterans Day. And so we're not going to go to questions and comments, President Galbraith, if that's okay, because we do have our primary speaker on that is now present with us. Dr. Jason Mitchell is the Chief Medical and Clinical Transformation Officer for Presbyterian Healthcare Services. He is also a Vice President of Presbyterian Healthcare System. He has a background in family medicine and informatics. I'm not exactly sure what that is, but I also know he has a very rich history in community health. He is one of the top people in Presbyterian and working in our state, working with Los Alamos National Labs on the projection models and helping us keep track of this really challenging virus. And so he's a very busy individual. I could read you a whole bunch of wonderful things about him, but I think he would probably rather us just turn it over to him and give him an opportunity to share what he thinks you need to know in order to make really good decisions. And also what our community may want to know as they look at how they protect their families and their children. And so, Dr. Mitchell, we know you are very busy. Thank you so much for being here this evening, and I will turn it over to you.
Absolutely. Thanks so much for having me. I really do appreciate the opportunity. As you said, I am a family medicine physician. I've been with Press for 14 years, and I was faculty at UNM prior to that. Never thought I would spend this much time with COVID, but it's been a great opportunity, and hopefully we've made some differences, and so happy to be doing this. I thought maybe what I could do is share with you some of the work that we did early on around modeling for schools, partnering with LANL and the state team that was doing the modeling, so a large group of us, and give you the history, and then talk a little bit about what's going on today, and then answer questions, and that kind of gives you the background of how the thinking was as we set up recommendations for the state, and then what that means today. And so it really, as this pandemic began, one of the things we were looking at is, what's the role of schools, either in contributing to the pandemic, or what's the role of schools in being safe when there is a pandemic. And the real question is can we open the schools? That was the question we want to answer, and if so, how would we open them? And what we did, and this is really partnering with Los Alamos National Labs, is looking at the rate of infection, looking at the rate of positivity, looking at the distribution of infections in different age groups, and then modeling what would occur if you were to bring cohorts of schools together. We're fortunate that we could partner with LANL because they've got these huge simulations they've used for past pandemics, including one model that has about 2 million what they call actors in it that behave as humans would in different age group and demographics, and they can run thousands of scenarios and then see the most likely scenario to come out. And so it really is an interesting predictive model. And in going through all that work, there's a couple things that we got out of it. The first is having all the kids go back to school and not doing anything is a terrible plan. And what that showed is that you would basically see about half the schools would have cases in about 30 days, and then it would just spread. And obviously you'd shut down schools and contribute heavily to community spread. And so that really didn't make sense. And so we began then to look at different variables that would allow us to get the schools back in some type of hybrid model, but still be safe in the community. The assumption is that we had a relatively low positive test rate. So the positive test rate was typically between 2 or 3%, but well below 5%. And the effective rate of transmission was close to 1 or less. So in those scenarios when we ran this, we found that a hybrid model could be done safely, especially in the K through 5th grade, because they really do follow the rules better and have less of that mingling of germs, really. We think of the youngest ones as being the worst, but in fact, they're just so good at listening to us and doing great things. So we found that we could bring them back. And as we looked at the ideal scenario really was a hybrid model, at least 2 cohorts split. So you split into 2 cohorts, and you have one there for 2 days a week and another there for 2 days a week. And you tried not to have the staff. Everyone wears the masks, and you limit the schoolroom size. And so that when we played that one out, it led to us seeing that you could open schools, and the vast majority of schools would probably have their first cases, I believe it was in about 90 days after opening, and then you'd continue to get some spread. But if you look at that scenario, it's not contributing to community spread necessarily, and by the time it actually gets in the schools, you have to say, okay, we've got a problem. It was Christmas time, right? Send them all home, have a break in quarantine. And so it really was, I think, a nice model. And as you look at what occurred, I think it's proven out very well, pretty accurate. If you look at the schools that have followed the rules and done things right, you guys done a great job. Our kids got to be in school. It's just been really, really amazing. There are some schools that were able to keep kids in a non-hybrid model and somewhat stay open, which is amazing. There are schools that did a hybrid model, and some schools, unfortunately, couldn't do the hybrid model because it's so hard to staff and the technology is so hard, where the kids couldn't have that model. So that's a little bit of the history and the modeling that we did specifically for schools. Unfortunately, we're at a point now where the effective rate of transmission is well above 1. It's 1.2. So for every person that has COVID, they spread it to 1.2 more people. And we have a doubling rate of between 2 to 3 weeks, which means if you're seeing 1,200 cases today, that's going to double in a day. That's going to double in 2 or 3 weeks. So we're in a significant growth phase. Additionally, the positivity rate for the tests is ranging between 10 and 20%. So when we're going out there and testing the whole community, you have a high positivity rate, which means you have uncontrolled spread of COVID. There's a couple challenges with that. One of them, it means your modeling is going to always undercount. So our worst cases are now not as accurate because there's a bunch of spread that we can't even predict because of that uncontrolled spread. And so we went from a state where we had good control in the state. Schools were able to open a hybrid model. It did not look like it was contribute to the community, and it looked like generally you could create a safe environment for your educators and children. Now we couldn't even run that model because the requirements for it to work is that you have to have COVID in control. You have to have a low transmission rate, and we are, as a state and generally as a nation, completely out of control. And so that's the challenge today. Is we are in I think a growth phase. It's getting worse very quickly. As we actually met as a modeling team today, and we look at the mobility of people using cell phone data across the state. We look at the positivity, and across all the scientists that are looking at this, we're not at the crest. We're still on the rise, and we don't know how far it's going to be before it rolls over. It's going to take either all of our communities getting scared enough that we all change behaviors.
So Noreen, go ahead and finish your.
Okay. Yeah, Doctor, my final question was, are we seeing more children get sick now than in the beginning? And is this disease morphing to affect younger people more?
So what you're seeing, the disease isn't morphing. What you're seeing is that each age group is all equally going up in infections. And even if you don't, if you have, a symptomatic rate of only 10 or 15% or 40% of kids, the more you get, the more you're going to see symptomatic cases. So it's not the disease has changed. It's just we have a lot more people infected. Just like now you're starting to see, you saw a report of a healthy 30-year-old that died from COVID. And it's not that anything's changed other than the fact that there's a lot more 30-year-olds infected. And, odds are because of that mortality rates, more people are going to die. And so that's really what you're seeing.
Thank you for answering my questions, Doctor.
Of course.
Okay, we'll go over to Board Member Cullen.
Hi. What are we at capacity-wise right now in the hospitals? I know that we were close to capacity, but that was like 2 days ago that I saw, so I'm not sure if we've already hit it or getting very, very near it.
Yeah, no, we've already been past it. This weekend, we are absolutely past it. UNM has been past it. We've been past it. What we're doing now is we are stopping all elective surgeries so that we don't have to take up any beds for those. We're looking at consolidating our clinics down so we can bring in doctors from clinic and nurses from clinic into the hospital to help. We are pulling every possible lever. We know that right now, the cases you see in the hospital were based off people that were sick 3 weeks ago, and our numbers were much lower then. And we know the projections. We actually can project 2 weeks out, almost with a 95% accuracy. And we know that our hospitalizations will be up another 50% from what they are today, and we're already overwhelmed. So you will see really stressed hospitals very shortly, and they already have been stressed. Of our 3 hospitals in the metro area, the Presbyterian, Lovelace, and UNM, one of them was having to have multiple patients per ICU room already. One of them has had to convert a neurology clinic into a ward for sick people that weren't in the ICU. We're there. There's no more capacity, and we're pulling every single lever we possibly can at this point.
And with that, so are they going to be using, they spent a lot of money and effort to change that hospital over Gibson, the old hospital. at the beginning of the crisis. So is that going to be up and running then to be able to bring more capacity, or do we just not have the people to staff it?
Right. So the limitation is not the number of beds, but the number of people to care for them. And so you wouldn't necessarily try to dilute dilute one hospital to staff another one, because it becomes much less efficient. It takes a lot more staffing. And so at this point, there's no staff to staff that hospital. And we have all hands on decks in our hospitals and in UNM's hospitals and Lovelace's hospitals. But we don't have staff to staff that hospital. So at this point, I'm not sure exactly what the state's plans are. The medical advisory team has made a few different recommendations of ways it could be helpful, but it's really up to the state to decide how to use it.
Yeah, especially since they converted it, and that was the whole purpose of it, is to have the overflow, is my understanding, but I don't know why they did that if they didn't have the capacity to staff it.
I'll tell you, I'm glad they did it, and I'm glad it's ready. If things get a whole lot worse, then we're going to be doing things we never thought we would be doing. It will be like battlefield medicine, and we will actually want that facility.
Well,
so
I was wondering if the National Guard called to staff it for the medical.
Yeah, we're talking about, we have a lot of contingency plans right now. So doing all the stuff I described to make sure people get great care. At some point, if there's more sick people, then we go into a crisis management. And it's a whole different way of practicing medicine. We do not want the state to get there, but if that happens, we're going to want the oxygen over there. We're going to want the beds, and it may be retired physicians over there. It may be folks that don't normally do that work, but that's better than people having nothing. So I don't want to scare you all. That's not where we are today. But from was it worth the investment? Even if we don't ever use it, I'm glad that we have that capability.
So if we continue with these numbers, when do you think we would be at the crisis level?
If we continue with these numbers, within 30 days, we would be entering that.
30 days, okay.
Yeah, 30. It's very, very close. I think 2 weeks ago, we were at the tipping point of having to pull our contingency levers, and things kept to grow, and now we're pulling out the contingency levers. A few more weeks of this, and we're headed towards a true crisis standard of care, which none of us want. It's kind of your nightmare way of practicing medicine.
Okay. All right, thank you.
All right, and Board Member Coleman.
Thank you. I did want to say, so I work for UNM Medical Group, and what we're seeing is over 100% capacity, probably in just about every area that we're talking about. So this is something that my concern is really that we're not just dealing with what is right now, but with what we see right now. And I think we really need to seriously take that into consideration, that we might be at 100 and whatever percent capacity ICU, but based on what you were sharing, that number will grow as a result of that.
Yeah, we're at an interesting point. And I actually spoke with another high school here in town, probably one of the private high schools asked, speaker, and it really is at a point now. There's can we open schools, keep everybody safe, and not contribute to community spread, right? And that's where we were. And now we're at the point, okay, well, can we keep the kids safe? Can we keep the teachers safe? And pretty close we're going to be to, can we afford to have any additional community spread if we're in a crisis standard of care? Any extra cases are going to have really negative impacts. And so unfortunately, we're kind of moved down that continuum now, and it changes the role of school. It just changes the role that you all play in the community from what you have the ability to do.
Do you have more, Wynn?
No, I'm
okay.
No, but thank you for being on and talking with us.
Okay, thank you. And Dr. Cleveland, did you want to go, or should we let Dr. Mitchell continue on?
Yes. Yes. Just a couple of things. Again, thank you very much for coming. And yes, we know that younger students are not as likely to get as sick, or that it's normally not as big an issue. But right now we have a student in this district who is critically ill with COVID. And so we know they're not totally exempt from that. And maybe there aren't as many, but certainly that is an issue. And I think you have hit on the most important issue, is can we keep our students and staff safe? And a lot of times we have a lot of conversation about students, but we don't always have a lot of conversation about the staff. You can't run schools without the staff, and so we do have a large number of folks who are in the higher age brackets that are perhaps more vulnerable. The other piece that I think is kind of interesting, and superintendents stay in touch and are working through this together, particularly the larger districts. I know that in the southern part of New Mexico, the virus is spreading very fast in Las Cruces, and they are not able to go over to El Paso as they have in the past for medical help. They've shut that off. And then I think I understood from a presentation I heard earlier that in Presbyterian regional hospitals across the state, people are not coming here like they did in the first wave because there's no room and they're being forced to stay there. So the virus is in all of those communities because they are not able to leave and go somewhere else. And then I did hear that Presbyterian is recruiting some nurses out of Canada to try to bolster the number of folks that we have here. But unfortunately, some of the folks here are headed for greener pastures in some other places. So we hope that most of our folks will stay. But we just, we appreciate all the work our first responders are doing and all of our folks in the medical community. Many of them are parents in this district. We try to work very closely with our hospitals here in Rio Rancho. Appreciate Angela Ward and Jamie Silva Steele, both who have really been helpful as we looked at this issue. But I think from your presentation this evening, what my takeaway from all of it is that the picture has changed, and it has changed dramatically in a very short period of time. And therefore, we are going to have to look at some other options. When we moved to hybrid, we really wanted this to work for our children. We really felt our children should be in school. And we worked very hard to make that a reality. But we're seeing now the situation is quite different. The really positive out of all of that is we've had 8 weeks of direct instruction. Those children have been in those schools for 8 weeks, and we think they've greatly benefited from that. But I do think our situation is very different. And I think you have put it a really good picture for me in terms of what those challenges look like. So again, thank you very much. And I will hand it back to President Galbraith.
Yeah, Dr. Mitchell, did you have more that you wanted to go over tonight? I kind of had the feeling that you still had some more things that you wanted to talk about.
Honestly, I hit all the high points. I think the issue is the pandemic is getting worse, not better. The spread is absolutely uncontrolled, and our health systems are really almost in crisis standards of care. And so as a community, we just don't have the same options right now. And it is really weird because I come home and my family's here and things feel okay when I'm in my home, right? It's just so hard, even around it all the time, it's hard to get my head into the fact of what's occurring. And I have to go back and check my numbers. I'm like, well, that can't be right. I'm sure this is wrong. But it's really clear where we're going. And so we need all hands on deck to help us, stop this. And so that's really, I'm happy to answer any questions. And I really do appreciate you guys inviting me and listening and thinking about the data as well.
Dr. Mitchell, what's the feel in the hospital for our healthcare workers? Are they doing okay? Are they really, I'm just kind of curious as to how they're feeling as they're working through this right now. It's kind of what we thought was going to happen and didn't quite get as bad. And it was bad, I know, in the hospitals when this first started. But what's kind of the current status of the feeling that's going on in the hospital?
Yeah, I think, early on it was a lot about personal safety. Do we have personal protective equipment? How bad is this going to be? Just a lot of ambiguity. And so there's a certain stress with that. Now it's a very different thing, right? It's just this constant sprint that we have to do where the volumes keep going up and up. And now it's clear what's going to happen. We have better treatments, which is great. So you see less patients on vents and you see a lower death rate in many populations, although really some populations it's just devastating how bad it is. And so we're getting better, but from a healthcare worker, it's exhausting, right? And you don't see an end to it, which is what's really scary, is it's not going to get better in the next week or 2 or 4 weeks or 6 weeks. And so we've got a lot of exhausted people. We have a lot of folks that really suffered through that first round. When we closed the visitation, when COVID was spreading really bad, then all the healthcare workers in the hospitals are being with people who can't have their family there with them. And they're spending those last minutes with them and they're holding the phone. And it's just, we're always part of that, but it's a different level of being part of that. And I think that carried a pretty high burden on our healthcare workers as well. So you got folks that are tired. We're doing a lot of stuff to help them. We've got a ton of programs for resilience. And whether it's counseling, whether it's group activities, we do a ton of communication. We really have focused on keeping them healthy and well. We had 55 nurses coming to town today from out of state, and we've got more coming throughout the week. And so we're doing everything we possibly can. But you got tired people who are working really, really hard. I mean, just like at UNM, we're all sitting above 100% capacity. So everyone's working all the time, and there's just no respite. And that's the way it's going to be for a while. And so we're hopeful that we can get some respite. I think that, the biggest thing that every clinician lives with, no matter what your specialty is or profession, is if you don't take the best care of somebody and something bad happens to them because of something you could have done differently. And the busier you are and the more you have to compromise, the more you worry about that. And that alone, even if you do it perfect, worrying about it keeps you up at night and haunts you. I think we've got a lot of people in that state right now.
Thank you. Thank you so much, Dr. Mitchell. Go ahead, Secretary Scott.
I had a question about the modeling. Have you modeled the mental health side of this? We're hearing that children are depressed, that our families are struggling. Are you looking at any of that in your modeling?
We don't have a behavioral health cut of this yet, but we all suspect that we're going to have a lot higher rates of that. Some of the indicators just for substance use disorder and alcohol use disorder are showing that there's a lot more of that going on. And we know that if people have been avoiding care, they've been avoiding it for behavioral health needs as well. So it's not just the pandemic causing it, but people have not had the care they need. We saw that whether it's behavioral health or whether it's heart failure, people were not getting care early in the pandemic. And for a while, our hospitals were way more full than they usually are with people with heart attacks and strokes and blood infections because they had just delayed care because they were scared of getting seen. We did a large study just looking at people's attitudes and values around healthcare. And about 40% of people, or actually no, in New Mexico, it was 51% of people were afraid to get healthcare because for fear of getting COVID. Now, the truth is the number of people that got COVID from healthcare is next to zero. We're actually not even on the chart of where COVID comes from, but it's that fear, right, of that's where the sick people are. And so from a fear standpoint, it makes a lot of sense. From the evidence doesn't support it, but that's what's driving people's behaviors. And so I think behavioral health is huge. We have a couple of programs launching this year and next year, specifically looking at bolstering up behavioral health.
Thank you. I think that's real important. One other question: do we have enough PPE? Do we have the equipment we need? Do our doctors and nurses have gloves and masks and all the things that they need?
Yeah, at this point, we do have the PPE we need. We were able to stockpile it. At some point we paid exorbitant prices that we'll never regret, but we paid a lot. But we made sure to get a lot of PPE of all sorts. We actually have a daily dashboard we monitor. We make sure we have enough on hand. And then we've saved all the PPE that's been used in the past and have the ability to reprocess all of it. And so right now, no one's using reprocessed PPE because psychologically that freaks people out. It's very, very safe. It's been done. But what we did is we stockpiled all of that in a huge warehouse. So on top of all our new PPE stores, if I don't know what happened, I don't know when we'd ever have to dig into that, but we can reprocess and have tons and tons more PPE. So at this point, we at least have the protective gear people need.
Thank you. Board Member Coleman, did you want to ask a question?
No, I have more of a comment, but I think that I will save that for out of respect for the doctor's time.
Okay, sounds good. Thank you. Board Member Cullen?
I was wondering about basically the pharmaceutical supplies. So I know, and I don't know how to say it.
Remdesivir.
Yeah, thank you. So I know that's been a lot that they've been treating using that. Do we have enough that type of supply? What you guys need to treat this as well? I mean, especially if we start getting into these high levels and we're thinking we're going to be doubling the capacity.
Yeah, we are getting good supplies of remdesivir, and actually we're working on opening up basically an outpatient clinic to do infusions. Trying to figure out a way to do that. The way the exemption works is you have to be hospitalized, and then that limits the number of people that can get it to those folks that are in the hospital when there's people that could still be at home and benefit from it. And so right now we're trying to tackle how to give it to people when they're not in the hospital. We haven't found a solution for it, but it's something we're working on. So it's something it is effective, it does help, and we'll continue to work on it. Obviously it works best if it's done early and before someone's severely sick.
Okay, all right, thank you.
Mm-hmm.
Thank you. Is there anyone else? Go ahead, Dr. Cleveland. I see you have something.
I do.
Just another quick comment, and thank you for coming. And I just want to express our thanks. We have a wonderful partnership with Presbyterian. We have for many years in this community. Through the early times of COVID and through some other things, we've had Presbyterian reach out to help feed children in this district and their families. We have found their help in many, many other ways. And so I think it's one of the really pluses of Presbyterian, but also some of our others, to reach out and try to be an important change agent in the community and to help people have good information so they can make good decisions. But I just want to express how much over the years I've been in awe of Presbyterian's commitment to community medicine and to being a good partner with other entities. And of course, Pres serves many of the employees of the school district. We are the largest employer in Sandoval County, and so we appreciate that. We appreciate that help and assistance. And this has been very good information. But I did want to thank you for that partnership and what a difference it has made in so many different areas.
Thank you, and thanks for taking care of all our kids. I think you got the hardest task.
And I do have, if I may, President Galbraith, I do have one other question, and I don't know this with the election now just kind of being settled and kind of that transition. Is there any concern about support as things kind of change hands and really kind of addressing this? I want to make sure that this is kind of top of mind. And I just don't know if this transition will in any way kind of slow things down. I just wanted to know if you have an opinion about that.
I can't read the tea leaves on that one. I think that one thing we are seeing is that there's a lot of COVID crossing state lines. And it's either through cars, it's through planes, it's through trains, it's through everything. And so we are, as a nation now, we're out of control. And a lot of the spread we can tell is actually from travel. And so if we had all the states behaving in the same way and got all the rates down at the same time, we'd get much better control as a nation. And so if that is part of the new plans for controlling COVID at federal level, was getting more of a consistent approach across every single state, that probably would improve our control a lot. I have heard as planning that's a piece of it, but again, it's so hard for me to know exactly how it's all going to play out. I don't see any immediate changes between now and the change between our presidents, the president and the president-elect. I haven't seen anything that signals that we would be better or worse during that time period, but it's just so hard to know what's going to occur.
Thank you.
Mm-hmm.
Okay, Jeffrey Morgan, did you have anything else you wanted to add?
Yeah, I do have one question. Do we know what the percentage of individuals who's had COVID and then test negative, and then all of a sudden they got it again? Have that been tested? Have they seen results from that?
No, so there's a couple issues that I think it's a great question. So the first issue is, can you get COVID again? And right now, it has happened. We're not seeing that in New Mexico necessarily. But what we do know is there's no data that suggests that having COVID once gives you lifetime or long-term immunity from it. And like most coronaviruses, which is a common cold as well, you can get it again in the future. You get a transient immunity that lasts a certain period of time. And some of the studies are showing a decrease in antibodies over 3 to 6 months. So I don't think, there's no evidence that says that if you get it, you're going to get herd immunity. Most likely this will be just like influenza and you have to get vaccinated for it every year. So that's one piece of it. There's a second piece of people that were negative and negative positive. Sometimes that's the type of test that was used. Some of these rapid tests are not sensitive, meaning that if you are asymptomatic and have a low pretest probability, oftentimes some of them are only 75% sensitive, which means they miss 25% of the positives. Mm-hmm. And so that's really concerning. So a rapid test works really well in a symptomatic patient in the first 7 days. You have a high pretest probability and you're more likely to get less false negatives. But again, you've seen these rapid tests used all over the place versus the PCR. And so then you're getting people with ups and downs. And then the third thing that you're seeing is there have been a couple internet scams or Facebook social media scams where people start a whole thing about, I got a call and they said I was positive and I hadn't even been called yet. And it's been the same scam in almost every single state, but that hit the media too. So it really creates confusion as to, what's long-lasting immunity, what is because of the test we're using in different sensitivities, and then what is, the stuff that you see propagated in social media. That was a long answer, I'm sorry.
No, that's a very good answer. Because I've talked to people that at one point in time, the results were negative, and they had to go back because of the job they have. Then the results was positive, and then it almost like you said, a roller coaster piece.
Yep.
Showed positive 1 week, negative the next, and they just got concerned.
Yeah, and the other thing is, once you test positive, it really, or negative, it means that you're good for a couple days. But if you're early in an infection, none of the tests will pick it up. And so you can have COVID and be really early in the infection, test negative, wait 3 days and test positive. And so typically when someone has an known exposure, we ask them to wait at least 3 days before they get tested, because otherwise the test isn't effective. And so even the timing impacts it. So it does get really, really confusing for folks. And that's a lot of why we say, if you've been exposed, you think you have it, just stay home for 14 days and the whole family has to quarantine with you. Because then you don't have to deal with that, what type of test did you get? But it's really confusing for everybody, and unless they know which test it is and the sensitivity and specificity, which even the most doctors aren't going to know, it makes confusing results.
Oh, okay, thank you. Thanks for your work. Appreciate your time.
Absolutely.
Board Member Coleman, go ahead.
Yes, and so I did have a question about the rapid test, and I know that there are pharmacies now that are offering a rapid test, and when you go, you swab yourself. And is there concern about that and it not being done correctly, and a test coming back negative, that really when someone is positive?
There have been studies on the self-swabbing, and as long as it is observed and instructed, they can be very effective. And actually Presbyterian has been part of some of that research. So when they have you swab yourself, they observe it, give you instructions, and confirm that you did it right, then that portion does not introduce much risk. Again, though, the actual, whichever machine and reagent they're using may have different sensitivity and specificity. And so it's really something to ask as you get swabbed, what's the sensitivity and specificity of this specific test? And actually, if you find out which one they're using, you can even look it up and see. Now, I know that's not a normal consumer's behavior.
It's a training. The other question is then, and who is training the people to administer these tests?
So it's going to be different in each organization. So at Presbyterian, we have competencies, we do observed. We got a lot of training to make sure they're doing it right. Tricor does the same thing, but every organization is going to set their own training. And so it's going to be a different organization by organization.
Thank you.
Okay. I don't want to cut anyone else off. Is there anyone else that has a question for Dr. Mitchell? We're just so excited to be able to ask you all of our questions.
I'm really happy to help. Whatever I can do to help, and I'm happy to come back again if you guys need me for anything.
Okay, thank you. We really, really appreciate you being here. I know that this is a crazy time. I'm sure you're always busy, but I'm sure right now it's even a little bit more. And so we truly appreciate you, and all those that you work with. Please let them know how grateful we are for all the hard work that they are doing. And thank you for kind of letting us know what's going on in the hospitals. And I know what we do right now really affects what's happening in the hospitals. And I think that's the hardest thing, is that's not usually something that we have to think about. And right now we do. So we appreciate you coming out to our meeting tonight. You are welcome to stay on, but I know, as we were saying, you were busy. You are welcome also to leave tonight and to do the other things that you need to tonight. Dr. Cleveland, did you have anything else you wanted to say before?
No.
Okay.
Thank you guys so much. I really do appreciate getting to be here with you all. And if you need anything, just call me up in the future and I'm happy to help. We'll see you guys. Yeah.
Thank you so much. Thank you. We appreciate it. Okay. So before we move on to our discussion, we wanted to make sure that we weren't, that we were able to get to Dr. Mitchell as he got on, knowing that he's busy. And so we kind of need to back up for just a moment, even though we're kind of halfway through our agenda, and approve our prioritized agenda and the proposed time allocations. So I apologize that we missed that. We missed that part. Is there any discussion that needs to take place on the prioritized agenda as it has been written?
This is Secretary Scott. I move to accept the prioritized agenda and proposed time allocations.
This is Board Member Jeff Morgan. I second.
Thank you. Jane, can you take a roll call vote for us on this?
Yes, I will. Vice President Morgan,
Yes.
Secretary Scott,
Yes.
Board Member Cullen,
Yes.
Board Member Coleman,
Yes.
President Galbraith.
Yes.
Thank you.
Okay, thank you. I appreciate it, Jane. Okay, so from there, I know Dr. Mitchell has left, but I just want to kind of have a discussion too, just with us as the board on these things. And one thing that I wanted to bring up in our business, we do have this right now as a discussion action, but and I want to explain a little bit, and I know that we have a lot who are on tonight, is that as a board, we cannot discuss these things. We can't discuss these things out of an open meeting. And because of that, that is the reason that's Dr. Cleveland and I spoke, that I asked for that possibility to be on there, that in case things happen over the weekend or we listened to Dr. Mitchell tonight and felt that we really needed to take action, that it was on there. We cannot add things to the agenda without giving advance notice to the public. And so it's a lot easier to take something and move it to another meeting than it is to put it on. And so that is why it's on there tonight. And that, with that in mind, note that that all things are open and that we can move that decision to another time as we discussed tonight. I'm actually going to just move us into that because I think that we can have the same discussion with that business item and invite Dr. Cleveland to talk to us for a moment as we just before we start to discuss this a little further. Go ahead, Dr. Cleveland, if you will.
It's hard for me to get that speaker on sometimes. I think one of the issues, I think we've covered a lot of them already. I think the situation is now that we are in a very different situation than when the board approved going into hybrid learning and giving parents the option of hybrid in person or remaining virtual. And I think one of the important considerations is that we have a lot of our students and families that are virtual now. And we know some issues we have with that. We've had a lot of successes with that. But the situation, I believe, is different now. And I believe that the point that he raised about keeping students and staff safe now needs to be discussed again. And I do not think we're working in the same environment that we were back in September. And one of the things that we said back then was that as we moved into hybrid in-person learning, we would do that as long as we felt it was safe for the students and safe for the staff in the buildings. And so I think, our situation right now, based on what we've heard, is I don't know that we are at that point now. And I do think we need to reconsider where we are in terms of that and have the board discuss what are our next steps. As I said, there's also some other issues in addition to the COVID, and that is to do with the amount of travel that people have indicated that they're going to have. And it kind of hit me after his comments this morning. It's not only the travel and the quarantining that will make it hard for us to staff our buildings, but the travel will exacerbate the rise in cases. And so that's another factor that I really hadn't thought a lot about, but it's a good point. The more travel we have, the more cases we're going to have. We're going to have a lot of travel based on the responses that we have had so far. And again, if people want to be part of that survey, they can do so until tomorrow afternoon. But I do think it's time for us to have that discussion about where we are and what our next steps. And I think our next steps are, we've got to reconsider where we are right now.
Thank you, Dr. Cleveland. I appreciate it. So I'm going to go to you as a board. I think sometimes we have a tendency to be really formal, but and it's important to be formal, but I really want us to have a good discussion on this and people to feel, like you can discuss these things and that we can go back and forth on these things. And so I'm just going to start going through the board and you can kind of give your thoughts on things. And like I said, I think kind of everything right now is out there as an option of different things that we can do right now, what we can discuss. So let's start with, I'm going to start with Catherine Cullen. I feel like Catherine has things to say. I could see it. I felt it. So
and I've had this discussion with Dr. Cleveland. We know that the case has been going up. So talked about a week ago in reference to this. So I saw that Santa Fe, they are now going to halt hybrid starting November 20th, correct? Dr. Cleveland?
Yes, that is correct. And they were actually in hybrid only a very short period of time.
Yes.
They went hybrid considerably after we did. So, but yes, that's the decision they have made. The other district that I'm aware of is Los Alamos. And I know that they are making the decision to be out the week of Thanksgiving through the holidays, and with some time after the return of people in January. So I believe their plan is Thanksgiving to Martin Luther King birthday is the direction that district is going. And I think that's I haven't personally seen the situation in Santa Fe, but my understanding it's the same plan.
Okay, and then obviously we know and Noreen had touched on this as well, and we definitely wanted to have our students in there, mental health, definitely with the isolation. We know that there's a lot of concerns in them being virtual, and I was a big supporter of opening up the schools. I feel that we really needed to have our students in there. But the cases are on a rise considerably. So there's a couple questions. If we end up going virtual for all students, what about our special services for our special needs students? Would we still be bringing them into the schools?
In the past, what we've been told is when everybody goes virtual, everybody goes virtual. Mm-hmm. And so that probably will be the same direction that we have had. That being said, there were some students with the needs are so great, I would anticipate that we'll still have some of them coming in small groups. However, if the building is closed, if the building is being shut down, then no one could come into the building, including children with disabilities. So I don't know if the state will give us different direction in the second wave. But in the first was we could bring in small groups of children, the most severe children with special needs. But I do know that if they were to close the building because of COVID spread, they would not be allowed to come into the building either.
Right. But if we elected to go virtual for now, and the state hasn't shut down the schools, we can look at the option of keeping some of these students in there.
We can look at the option.
Okay.
I think the concerns that we have, and that is we really have to pay attention to the safety of those staff members who are with those children. But that right now, that is the direction we have from the state, is children with disabilities will be served in small groups.
Okay, and then a question is that can teachers teach virtually from their classrooms if we end up going 100% virtual?
The answer is yes, if the building hasn't been closed. And so if the building has been closed because of spread, then no, they cannot come in to the building and teach from there. However, if it's just we're back to just the normal virtual, yes, they can come in, providing they socially distance and keep themselves separate from other teachers. And so, some of our teachers really prefer to teach from their classrooms. All of their materials are there. The technology is better. Their connections may be better than they have at home. And so the plan would be to allow them to continue to work out of that site if that was their choice. On the other hand, if their choice was not to do that, we would honor that as well. And some of our teachers have literally fixed up classrooms in their homes. They've turned bedrooms into classrooms, and they've done some amazing things. It depends on each family's individual situation. And, as Dr. Mitchell was talking about the tremendous work of the clinicians in the hospitals and in the medical area. I think you are very much aware that our teachers have put out extraordinary effort. And one of the things that we've heard back from them is that they're working longer hours, harder than they've ever worked, and sometimes feel more frustrated by their inability to be able to meet the needs of each child. But I would favor giving teachers that flexibility one way or the other, unless, of course, the building has been closed. If the building's been closed, then no one goes in that building for 14 days.
And so, because I'm just looking at trying to look at the calendar, and I don't have it completely pulled up, but so the week of Thanksgiving is the 23rd, and then we go into winter break the 20th, December 20th and 21st, correct? Until January 4th?
Now, there's one thing I would add to that might be useful for the board to know. As part of that survey, when you see it next Monday, but we have about 28% of students and staff that will be gone the week of Thanksgiving completely. And you remember in the past, we had the whole week where they could be off. This year, the way the days fell, we did not do that. But so many of our families that are traveling are not going to fly. They're going to drive. And so they have indicated to us they will be leaving the weekend before, as soon as they're out of work on Friday, and will be gone that whole week of Thanksgiving. So that's about 28% to date that have told us they'll not be here that Monday and Tuesday. So I raised the real question of whether that Monday and Tuesday is really worth being open because of that information. And again, we'll have the exact numbers when next Monday, but that's where we are to this point.
Okay. And that was correct, is the 21st is winter break through the 4th?
Yes.
Okay. Okay. All right, I think that's all the questions I have right now.
Okay, we'll come back. Yeah, welcome back. All right, let me go over to Noreen Scott. Go ahead, Noreen.
Dr. Cleveland, when would we make up Monday and Tuesday of Thanksgiving week then?
I'm sorry, Noreen, I did not hear
when Scott. We make up those days? Don't we have to have a certain number of days? When would we make up Monday and Tuesday?
So we would still go virtual.
Because we will be virtual. They will be in school.
They will be
in school virtually. So those that leave, the parents who leave, will have the responsibility of working with those classroom teachers to get the work that their children are going to need. But we plan to offer, unless there's a change, we don't plan to close the schools, but being in hybrid doesn't seem to make a difference. If we were to choose to just close for the whole week, we would have to make up those days, and we would make them up at the end of the year. So, you really have two options. One would be to close completely for that week. We would have to make those days up on Monday and Tuesday at the end of the year, or we simply stay virtual. And one of the things that some of our families have indicated is when they travel, they can still be in their class. They can still make arrangements to check in on those Monday and Tuesday. And maybe bad news for our kiddos for the future, but I don't know that we'll have snow days anymore, because again, we'll have the ability to sign on at home and, but that's kind of sad, because those snow days have always been kind of neat for kids who don't see much snow in New Mexico. But you can do it either way. We can stay open and just stay virtual Monday and Tuesday. We can continue with hybrid Monday and Tuesday, or we can make the days up at the end of the year.
Dr. Cleveland, I would like to comment first that I think our teachers have been real heroes, and our staff going into schools, and I think that our hybrid model has been successful. And I really feel like our families have been happy to have the opportunity for their children to interact in a normal way. And, normal seems to be something that's a vague memory now. And so I think there's been real appreciation of that. And so I first want to say that I'm very grateful that everybody's been willing to try this, and that success sort of, has me hesitant for us to stop it at this point. But hearing what the doctor said today is sobering. So I'm anxious to hear what everybody else thinks. Thank you.
Just a quick comment about that. I want you to know most of our staff, not everybody is not in agreement on anything anymore. I mean, it's just the way the world is. I want you to know that many of our staff have expressed real frustration and sadness at not being able to see all of their children, all of their students. And so, and we know families feel the same way. This is not an ideal situation. But I can tell you that the staff who have met the kids virtually have given all they have to give. And they have worked really, really hard to make it work. And they love seeing those children come in every day. And so it is a hard situation. Thank you.
Thank you. Thank you, Dr. Cleveland. And thank you, Secretary Scott. Jeffrey Morgan.
Hey, my first question is around staffing with the schools. Dr. Cleveland, can you give me an update, kind of give us an update on where we are? I've been hearing that we're understaffed in a lot of areas. Can you talk about that for a couple of minutes, if you don't mind?
I can certainly, Board Member Morgan, Vice President Morgan, I can add some things that I think, number one, we still have some subs that are working very hard, but our number of subs are diminishing and are just much smaller than we've had before. So when we have people out, it's very hard now to cover those classrooms with anyone in person. It's also very difficult to cover those classrooms even virtually with subs. So we are short. When teachers are out, it's very, very hard to find anyone to take those classrooms at this point in time. The other, as I mentioned, we have, as of right now, about 40% of our students and staff who indicate they're going to be traveling over the winter break. And when they come back, they're going to have to quarantine for 2 weeks. Right. And so I do not believe if we have that percentage of staff out, that there's any way we have enough people to be able to open then. We just simply can't cover all those classrooms in person. Virtual is different. We can come back and meet those needs virtually, because even if people are quarantined, they can then teach for their homes or their classrooms where they're not students. So I think our biggest challenge right now, apart from the spread of the virus that Dr. Mitchell is talking about and a controlled spread, is staffing and how we're going to be able to staff. As you know, we've closed a couple of schools already and then reopened them. But in those cases, it was staffing. We didn't have enough adults to run the building. And so I can give you a scenario with one. We have a situation in a classroom. A student is having some challenges, some needs. The principal goes in, the nurse goes in, the SEAL goes in, and then other teachers may be assisting with that. And then we find out that student has COVID. And so all of a sudden, all of these adults have been exposed to it. Doesn't mean they're going to get it, but it means that they have to quarantine for the next 14 days. And we have other situations where we have a staff member who's been in most of the classrooms across the building. Most cases, we don't have that, but we have had it in a few cases, and where that individual has come in contact with numerous classes, not just one. So it's in some of those special circumstances that we have some challenges. That being said, for the regular classes every day, and if those students and teachers are staying in their classrooms, staying in their pods, eating lunch together, staying together on the playground, we have been able to do a really good job of stopping the spread. And so occasionally when we have a lapse in that, sometimes we'll get caught with a problem there. And we had a situation a week ago where we had 2 classes that interacted on the playground, and unfortunately one of the children had a positive COVID diagnosis, and so both had to be quarantined. And so every case is different, but staffing is one, just like in the hospitals, staffing is the number one difficult thing that we really don't have a lot of control over. But we are going to have a good number traveling both Thanksgiving and Christmas. They have already made those plans. I hope some of them, for their own personal sake, will reconsider it, just for their sake. But we certainly can't control people who want to see their elderly parents, or people who want to see their grandchild they haven't seen for 9 months. And so, people have to make those individual decisions, and we have to understand and respect that.
So, Dr. Cleveland, with all that being said, the challenges that we're facing right now to covering the classrooms, and with the percentage of people that say they are leaving for out of town. And again, I'm not trying to force us to make a decision right now. It sounds like some of these challenges that we're going to face, it looked like it almost is going to force us to go virtual for the most part, because we just may not be able to accommodate the classrooms. So if you could talk a little bit about that, that would help as well. I mean, it's almost forcing us in that area to a degree.
Yeah, I think the takeaway for me for this evening was Dr. Mitchell saying we may be in a situation that is spreading so fast, we really aren't going to have a choice but to go virtual. And then I think in the other, as I mentioned, one of our challenges with all the travel is I don't believe we will have the staff to be able to operate the school. And so if we don't have enough staff, we obviously can't do that. We are lucky in the sense that we have made such a strong commitment to virtual. We can move back to virtual learning. We did it for the first several weeks of the school year. We know that a lot of our families don't want that. I can tell you a lot of the staff doesn't want that.
Right.
But to your point, we may not have a choice given where we are at this point in time. And you can't, sometimes we talk about, though, as I mentioned earlier, we have a very ill child, and we're all thinking and praying for that family as they deal with that. But sometimes you hear the discussion of, students aren't very likely to get it and aren't very likely to get terribly ill when they do. And we have an exception to that right now. But you also have to think about the adults in the building. And you can't run those classrooms without the adults in the building. And so our teachers and our counselors, our nurses, and all of those other important individuals, you have to have them there in order to make the school district work. So we have to certainly give a lot of consideration to the safety of the adults in the building, as well as the children in the building.
Yeah.
Did I answer your question?
You did very well. And thank you so much. I really appreciate that. And then, of course, on the other side of that, I'm hearing a lot of stories about the mental state. Board member Noreen Scott talked about it. Cullen talked about it. We're hearing all kind of stories. I have to take that into consideration as well. While on one hand, we're saying we might be boxed in to have to go virtual. On the other hand, that may not be the best situation in some of the circumstances that some of these kids are facing on a regular basis, happen to be at home all day, just based off some of the stories that we're hearing. So, I'm kind of torn, to be honest. I think virtual is great, but I'm also more concerned about the mental state of these kids, and not just today, tomorrow. I mean, some of these kids could be impacted by this for the rest of their lives. And we could be dealing with a lot of this, 5, 10, 15 years from now. So that's the piece that really hurts my heart the most. I understand the importance of these kids being with one another. It helps them out tremendously, but is that the best thing right now? And that's kind of where I'm torn right now. I'm looking at both sides. So that's all I have, President Godwin.
Thank you, Jeff. Okay. Board Member Coleman.
Thank you. I wanted to share that as I said when Dr. Mitchell was on, that I work for UNM Medical Group. I'm in the ICU and the PCU. They're looking at not just like 102% over capacity at this point, but we're talking like 129, 117%. So my concern really is that I can't help but think that that might be a reflection of what we might be kind of dealing with when it comes to exposure for staff, for our students. And my concern is in keeping the schools open, will we have enough time if we have to get into such a crisis mode that we need to make an instantaneous change? And I think we really need to take seriously how we prepare for this, knowing that one of the probably the most cases coming up, and kind of what people are saying they're going to be doing. I can tell you that having had so many surgeries this summer and dealing with a situation now where my husband was in the hospital last weekend, and knowing the impact of what that's like because of the cases rising and his birthday, being when he was in the hospital and having to drop off a cake at the emergency room so they could take it to him. He could wave from his window. This is serious, and it's something that we really we cannot take lightly. I'm concerned that we have enough time to prepare for this, because I think that that's the direction that we're heading. And I do want to say that Tana was on a call today with the Sandoval Behavioral Health Coalition. We both sit on that committee. And that was a discussion about how we are as a county, really kind of meeting the emotional needs of our youth. And I think it will take a village to really address those things, not just the district. And I think that we need to come together as a community in support of the district and partner to go ahead and make sure that we're taking care of those, the emotional well-being of our students and our staff, because this is taking a toll not only on our students, but on our staff also. So, and that's really all the input that I had about this.
Thank you, Wynn, for that. So we can kind of go back around, and I see Noreen's kind of unmuted, but for just a second, you know, I think a lot of times it can look like we're just a bunch of people kind of just like randomly making these decisions, and I appreciate what Jeff said, because, and all of you, because we're not taking this lightly, and I'm saying that because I know we have a lot of people who are watching. We are not taking this lightly. I have 4 kids who are in the schools, and we have a good family, and I've seen with my own kids like how hard it is for virtual learning. It's hard. My kids have had good grades. Some of them are having a hard time, and so I don't take this decision lightly, but I also have family who work in the hospitals, and I see the stress that's coming out of those hospitals. And we know when those hospitals are over capacity, that is when people start to die because they have no place to go. And so I was talking to Dr. Cleveland earlier today, and we always want this kind of balance, and we don't have it in this situation. We probably, this decision that we make impacts our community even more so than it did last time we made it. It impacts our community. And last time it was hard to make this decision. I couldn't sleep for a week as we made the decision last time. And this time I have those same thoughts as I'm worried for our kids. I'm worried for their mental health, and I'm also worried for our community as a whole. Not that necessarily we're going to cause the spread, but that we could create more people having to go into the hospital, and that is a huge concern for me. Noreen, Scott, I want to give you a chance to talk. I know you have some things you want to say.
Well, I wanted to ask Dr. Cleveland if we were going to continue to have the safety net that we had in the spring. Will we still be able to do meals? And what will happen with daycare for our folks working in hospitals and our fire and police who have children dependent on us? And as we heard from Dr. Mitchell, Presbyterian employees who count on us. Any feedback on any of that?
Well, I think that is one of the concerns. Certainly some of the letters that we received in the last spring and in the fall had to do with people who work in the medical environment. And need to be able to get to work. And so we know that's certainly a challenge as well. And so it's, but with regards to services such as food services and all of that, there won't be any break at all. The FDA has said, USDA has said that food will continue for children and families, regardless of whether we're all remote, whether we're virtual, whether we virtual or whether we're hybrid and some in person. So children will get fed regardless. And I don't think people need to worry that their children will not get meals as they are getting meals right now. But it is, the issue of providing not only support, which we did last time for some of our first responders, but also looking at providing support for our teachers. It's pretty hard to teach when your children are home and there's no place for them to go. Sometimes that's a real challenge as well. And so looking at, daycare arrangements and see if there's any way we can help support our staff. And as you recall, last year we did provide some daycare for first responders, whether they be hospital first responders, whether they be, I can't talk, whether it would be the police first responders. And so we did offer that support. I don't know if the situation is as serious now, because I think a lot of people have been thinking all along, what if we have to go back to virtual, what will I do? In the spring, everybody was caught totally by surprise. There was no planning and whatever. We've told parents from the very beginning, have plans in case we had to move back to virtual and be thinking about what you would do in that circumstance. So I think many of our parents do have plans. That being said, there has to be a little bit of time for people to prepare and get ready to do that. And so I don't know what that amount of time looks like. That's certainly something the board would need to talk about. But I do think you've got to give people a little bit of warning before you move, so that they can make arrangements for their families. And the same for those people who work for this district, who may need to make some arrangements for their children.
My final question is Shining Stars. Would Shining Stars stay open, or what would you see them doing? And then I'll turn off my mic.
My understanding is that Shining Stars, would follow the rest of the district, regardless of which way the district goes, would not be different than the other. That's my understanding. And so if there is that's how it was last time. If there is a complete total shutdown, then my understanding is that Shining Stars would function like an elementary does.
Okay, Captain Cullen, go ahead.
Dr. Cleveland, so I'm assuming the reason why, because I was looking at our calendar, the reason why Santa Fe went to after Labor Day was to give those 14 days of quarantine after winter break. Is that sound about accurate?
That's correct. And the thinking behind that for both Santa Fe and Los Alamos was that people will travel up through the first that weekend, and then they will be quarantined for 14 days if they have gone to a state with a high number. And right now, as Dr. Mitchell shared, that's almost everywhere. And there's very few states that are not on the list right now.
So, and you say we can't prevent people from traveling, and I understand, we can't tell them you can't travel, but are they paid for 14 days to quarantine after they travel on a break like that? Because that's 2 weeks because if they were assigned to be a hybrid teacher and then they can't go into the schools, are they paid for those 14 days?
Well, remember now, when we say that they won't come back in person, let me back up. You really have two options with regards to this, but not coming back in person doesn't mean they would not necessarily be teaching. They would be teaching virtual. They're teaching virtual, of course they're going to be paid. If they were not coming back at all, and we're not teaching at all, and they made the decision to travel, they have to take their own personal leave for that.
Right, but if they were assigned to be a hybrid teacher so say if we didn't close and we had it open back up right after winter break, and then all these teachers who should be in the classroom, say they were hybrid.
They would be hybrid, just like the snow day. Those teachers would be teaching, but everyone would be back would be back in a remote learning environment. There would be no in-person learning. And so, but there would be remote learning. If there was nothing, of course, you would have to make up those days and you would not be paid for them. So if you come back and you say, okay, I've traveled and I have to be quarantined because I traveled for 14 days. That doesn't mean they can't teach when they're quarantined.
But they can't teach in classroom if it was hybrid, though. They can't return to the school for 14 days.
Right. Well, I think what Los Alamos and Santa Fe are doing is they are going back in virtual for everyone.
Well, I understand that. I'm just saying, as a board, if we did not, say we said everybody goes hybrid after winter break. I mean, we're back to hybrid after winter break. And you're saying there's a possibility we'll be short teachers for those in classrooms because they went on vacation. That's my thing is that, do you understand where I'm going? Is that?
Yeah, okay, and I'm sorry. I guess I'm just not saying it very well. So we have two options. We can come back, and if we come back hybrid, then those teachers would have to be in the classroom like they are right now if we hadn't made a change to do that. But what I'm saying is I don't believe there will be enough classroom teachers to go back in hybrid with the number of people that are traveling. So they could come back. We could start school after the break, but it would mean that teaching virtually, regardless of whether they're a hybrid teacher now or we're a virtual teacher in the past, all teachers would be virtual, just like we did before we returned in September. So the first month of August, if you recall, everybody was teaching virtually. There were no hybrid. And that's what we would be going back to.
So the consequence would be on us that we would have to go virtual because we don't have enough teachers to staff it because they went on vacation.
That's right. But if they made that decision, to your point, are we paying them? No, they will have to take leave. So they will have to use their sick leave. Now here's the difference. If we had a situation where someone was exposed and we tell them, you must now stay home for the next 14, 24 days, whatever. When we tell them they have to stay home, they have to quarantine, then that's different. And they can use that 14 days of COVID leave. But when you make the choice to travel yourself, then you are responsible for your own leave and you have to take your own sick leave in order to be paid those days. And many of our staff have sick leave. And they could take that sick leave. The state has said they can take their own sick leave if they choose to do that. But it will not be the days of COVID leave that have been assigned on top of their sick leave balances that they have right now.
But we're pretty much in a predicament that we're kind of almost forced into doing virtual after the winter break because of this. I mean, it's kind of forcing the hand of the board to do this because so many of them are going to be out on vacation. So there's not going to be enough teachers to teach in the classroom for a hybrid version.
That's correct. But I really caution the board making the teachers the villains here.
Right. No, and I understand that.
In some cases, they have, as I said earlier, they may not have seen their elderly parents since last March, or they may not have seen their grandchildren. And you recall during spring break, we did ask them not to travel. And most of them did not travel during spring break to help us to get ready to open under a virtual model. And so they gave that up. And I think a lot of folks are just saying, I have to see my family. Or I have to, I have parents with needs, or I have other kinds of situations. So I sure don't want it to be to be implied by me or anyone that teachers are villains for doing this. They have families too. They have needs. The state did make a plea. PED and the governor's office did make a plea for people not to travel if there was any way they could delay that travel, for the very reason you're saying, is that it will put so many people out. But our initial response back for the Christmas holiday, the winter break, is 40%. And it's not just teachers. It's on the other side. Families are deciding to travel as well. So we've got a lot of kids that are not going to be able to come back because they have traveled with their families. And so they can't come back either. And so then that raises the question of what do we do for instruction? Again, if all of those children have to stay out 2 weeks, you obviously would want them to go virtual so they didn't miss out on the teaching and learning that's going on then. But it isn't just teachers. It's not just school staff. It's families. And a large number of families have told us they're planning to leave and be gone during that time. And they've already notified us that their children will be virtual the 2 weeks after they return.
So, and I guess I just want to make it clear, I'm not trying to make anybody as villains. I'm trying to say this is what we're in this situation. And I have no problem. I understand people want to travel. I mean, we've been cooped up here for a very long time. We've, and people want to go out, absolutely, and they have family to see, and as well as students. So I don't want to have that come across it, but I'm just saying, basically, it almost seems like we don't have a choice because of the situation. So we're talking about choices, but realistically, do we have a choice? And I guess that's kind of where I'm going with that. And so if that's the case, then we're going to have to look at till the day after MLK, if we're being realistic on this. So that's kind of where I was going. This is pushing the discussion of this be realistic. Coming right after winter break, it doesn't sound like it is realistic because there's not going to be enough teachers in the classroom to be able to do it because of that quarantine time. Whether they had to take personal or they were just, or going virtual. So, and then if we close down just before Thanksgiving, so they're basically out 3.5 weeks because you have that Monday, Tuesday, because they're already off on Wednesday before Thanksgiving, correct? So we'd be about, well, actually, no, and then we had 2 weeks after the winter break. So we're looking at 5 weeks, 5.5 weeks being out of the hybrid model if we move to the day after MLK. Is that right? I was looking at my calendar earlier, so I'm trying to just look at you guys now instead of my calendar. Does that sound about right, Amanda?
That does sound right. I've been
about 5.5 weeks outside hybrid. My thing is I don't want to wait. I don't want to push this off too long to make a decision. And the reason is we have to have families to be able to plan. And I think that I know some people are thinking going on till next board meeting, which is the 16th. And that would give you, the rest of the week to plan. Or if we think that this is something that we have to really do, then we'll pull off the Band-Aid and do it now so that they have the week to plan. This week and next week to plan. But that's just my thought on here, because that's where I was just trying to get to is what are we realistically looking at if coming back? And if so, and Thanksgiving, it's going to be 2 weeks if they quarantine then, and then we have about a week before winter break. So
yeah, thank you, Catherine. I appreciate those comments. And I think that you're right. And I think that's kind of what's being alluded to is that we have a lot of people who are going to be out of the school. And so do we have the staffing? Do we, and those things, and not that, I totally understand going to see family and everything like that. And I think that we all understand that, but do we have enough substitutes to cover those classes? Dr. Cleveland and I, when we had talked about setting up this agenda for tonight, I think that was the biggest thing that we discussed as creating this action item, is that we wanted to make sure that families have enough time to make arrangements. And and we don't know what the adequate amount of time is. By doing this meeting tonight, if we decide to go ahead and vote on it, that will give them more time. If we put it off to Monday, they would still probably, I think a lot of us have already made the decision, but they would still have time. And obviously after listening to this meeting, they would probably start looking into getting childcare anyway. The other thing that we have coming up is on Thursday, we know the governor is going to be speaking to our state. She may make that decision for us anyway. That doesn't mean that we shouldn't make that decision tonight necessarily, but she will. I'm guessing that she will be speaking about schools with the way the numbers are rising and what she would like to do in regards to that. So those are a couple of things to kind of keep on your mind as we discuss a little further. I would like to kind of have an understanding of if everyone would like to vote on this tonight, if it's something that maybe we want to put off. From what I feel from Catherine, I think that you're kind of on the side of going ahead and, as you said, pull the Band-Aid off and go ahead and do that tonight.
Obviously, this is not something that I would want to do. I mean, I think that especially Noreen, you said that, earlier, we are seeing the success of hybrid. We know the schools want the students in there. The students want to be there. Families want them, even with having to shut down due to COVID cases. They're excited to get them back when they're able to open back up. We know students need to get back into schools. I mean, there's just no ways around that. But our cases are going up so high so quickly, and even if one student or one teacher spread it to somebody else and then they go into their family and spread it, we're just going to see such a huge increase, and the hospitals don't have the capacity for it. And so obviously I don't want to do it. I just think that we have to be realistic on this. So yeah, we can wait until the governor, I thought the governor was going to do it last week once we saw the spike in cases, and she didn't. I think that she will probably, if I'm a betting person, to say that she'll probably do it this week. But do we just put that on the governor, or do we go ahead and say, do we know what we need to do? This is our responsibility to know what we need to do for our students, and whether we have to do it now or wait until the governor tells us to. And maybe she won't. Maybe I'm wrong. Maybe I'll lose my bet and she keeps it going. But the levels of what we're hearing today, I think realistically we can't do it, and we're not going to be able to staff our classes anyway.
Okay, thank you. Go ahead, Noreen Scott.
I was just going to say I agree with Catherine. I think that the governor's going to make the decision for us on Thursday, so it's a matter of whether we decide what we're going to do, or I think the decision's going to be taken out of our hands.
Thank you. Jeff, did you want to add?
No, I'm good, thanks.
Okay, I just saw you were unmuted, so I was checking in with you. Wynn?
Yeah, I just, I think we need to look at and really feel comfortable in the probability of these things. And I think probability-wise, there's going to be a problem. If we say we're going to stay with the hybrid, taking out, what the governor might announce, my concern is the preparedness for the district and for the teachers and for the staff. We already know the percent that's traveling. We already know kind of what that means. We know, where the medical, our hospitals are, and our PCU and our ICU beds. And I just think we need to just, we don't have a crystal ball, but we know where the odds are at this point.
Yeah, go ahead, Jeff.
Hey, Dr. Cleveland, correct me if I'm wrong. The governor decision supersedes whatever we decide anyway, correct?
Absolutely. The governor's public order in New Mexico is law.
Right.
And that was just affirmed by the New Mexico Supreme Court just a couple of days ago, that the public health orders have the force of law. So that was the ultimate decider for our state, and that was the decision of the Supreme Court.
All right. I just wanted to make sure. So based off the conversations a couple of the other board members were having, we should just wait on the governor's call, because If we decide tonight to go one way and she decide to go another way, then it would be her way. So unlike the other board members, I'd say we just wait.
I would think, I mean, this is just my thoughts, and certainly it's up to the board. I think, you can make the decision tonight, but I don't think you can make it any later than Monday. I would think that by Monday, at the very latest, a decision has to be made as to what, but that's just my personal perception, my personal recommendation. And certainly you could go with it tonight if the board is ready to do that. But I think Monday would be, from my perspective, probably the very latest that decision could be made, or should be made, if we're going to give people any time to prepare.
Right.
And Vice President Morgan, this is Catherine Cullen. I don't care if we wait till Thursday or if we do it today. I think that is probably inevitable either which way.
Right.
So I personally don't think that we need, for me, I don't think I need to wait until Thursday to hear what the governor has to say. I think I already know what's going, even if she doesn't say it. And I think that for what our district and the amount of cases that we're seeing, that it's going to happen anyway, we need to do it. And I would think that Dr. Cleveland, your recommendation would to go ahead and close do virtual until the day after MLK's birthday. Would that be?
Yeah, let's hold right there. Dr. Cleveland, what is your recommendation as far as, and then I'll go over to, I know Wynn has something to say too, but what would your recommendation be as far as a closed date and an open date?
I think, let me just say, I think we've got a couple of options for closing, and we'll share both of those. I do think, though, both Santa Fe and Los Alamos are right on track. Given the amount of travel that we absolutely know now we're going to have, that people are going to have to quarantine after they come back after the first of the year, that 2 week going to MLK is pretty much a given, given the numbers we already have about travel. And knowing that, if we have 40% of the people that are traveling over the Christmas break, there is no way that we can cover classes in person with that kind of travel. In terms of the starting date, I think we've got a couple of options. It depends, honestly, when you decide to make the decision. Because after the decision is made, we have to give families just a few days to be able to get things in order. And we have to give our staff a few days to get things in order for their own families. So if I would think, though, the very latest that we would go would be the 20th. And I think it'd go earlier if the board decides to go ahead and move earlier. But I don't see any point in coming back the 2 days before Thanksgiving, because we know we have 28% that are traveling over that time and won't be here. So with 28% of our folks out, that Monday and Tuesday will not be very, very successful days in terms of in-person instruction. So I think you have a choice of, if you make it now, giving people a few days, whatever you think is good for that. But if you make the decision on the 16th, then I think the first day would be the 20th, because you would almost have to give folks some time to make those arrangements. So it just depends on when you vote, when we would remove ourselves back to virtual.
Okay, thank you, Dr. Cleveland. You'll see that Jane went ahead and put up a calendar for us just so that we can kind of vision what she's saying a little bit better. And thank you, Jane, for sharing that. So we're looking at, you can see here on the calendar, we're looking at in our discussion, it would be, so the 20th would be the last day of hybrid of November as a possibility. Of course, we can decide whatever. And then the kids are coming back midweek in that week of the 3rd. And so we're talking about coming back on the 19th, which would be the day after Martin Luther King Jr. Day, which would be in January. Yes. Yeah.
2 weeks later than what we originally had planned.
And we would be in school, we would be in virtual learning. So we would still come back, but we would be virtual. Go ahead, Wynn Coleman.
Dr. Cleveland, can you please tell me what staff is telling you how much time they need to prepare if we go virtual? Because what I'm concerned about is if that decision is made for the 20th and everyone and people are going to be gone that week and traveling. I just want to get your opinion on when we should go virtual, if that's what we decide to do, when you think would be the optimal time. Staff has enough time to prepare and then still do whatever they have planned for the holiday.
Well, again, Board Member Coleman, on the 20th would be the very last day, I think, would be possible to go virtual because people traveling, as you can see on the 23rd and the 24th. So many of these folks that are traveling or driving, they are not flying. And so they are planning, they've told me they're planning to leave on the evening or of the 20th or the morning of the 21st to get wherever it is they're going for Thanksgiving. So I think the 20th would be the very last date. If the board makes a decision now, then what I have heard is a lot of folks have asked for a week, but I've had others say they can do it in 2 or 3 days. And again, we've been encouraging people to have that plan in the back pocket because we knew this was a possibility. So it depends on who you talk to, but I've talked to some folks, and it goes anywhere from 3 to 5 days is what I've been told they need to prepare. And again, we did not survey this, so the information I'm sharing with you is very anecdotal. I don't have any data that says, how many days people actually need to prepare. But I think 3 to 5 it would be reasonable. So it depends on when we actually decide to go back to change our calendar. So if the board votes on Monday, then I believe that people will say probably Friday would be the earliest they could make the transition. I think if the board votes earlier than that, then I think we could go virtual earlier than that.
But they will be in school that following Monday and Tuesday, correct? Right before Thanksgiving, but I say in school, but I mean virtual.
Mm-hmm. I'm sorry. I didn't mean to interrupt.
No, you're not interrupting it. Yeah, I think you're just hearing background noise, Dr. Cleveland. Go ahead.
I did. Yes, we would stay virtual those 2 days unless the board decided, and the board could change its own calendar. If we didn't want them to come those 2 days, we would have to make that up at the end of the year. And so, we have had some people ask, why don't we have the whole week? We've had that in the past. It was just how the calendar fell this year. So, but right now, the board calendar, the approved calendar, is that they will come back Monday and Tuesday, whether in person or virtual, on those 2 days. We are off on the calendar on Wednesday before Thanksgiving, and then out through the whole weekend, of course, for Thanksgiving. Did I answer your question? Okay.
Catherine?
So, Dr. Cleveland, I know if we made the decision on the 16th, it would be the 20th. But if we made the decision today, I guess it could be done earlier to pause the hybrid. But my question is would it be worth trying to do it before the 20th? What is the crisis level at the schools right now with the COVID cases? Would you want to see it shut down to go virtual sooner than the 20th?
I'm really torn on that because, as I shared with you earlier, we have no spread in the schools right now.
Right.
Spread is coming from outside. But as you heard from Dr. Mitchell, the outside is growing super fast. I mean, the cases are, I looked on November 1st, we had 750 cases in New Mexico. And yesterday we had over 1,400. So in 2 weeks, we've gone from 750 to 1,400 cases. That's a tremendous increase in a really short period of time. So, if we have that same level of increase, again, we don't stop this and get it turned around, then we may have a lot of cases in the community, and it's the fear is that it will start spreading in the schools. And I think that's what we heard this evening from Dr. Mitchell. We've done a good job. We've kept it from happening. But at some point, he used the very term tonight, it's going to tip over. And we're going to start seeing some spread in the schools themselves. So, I think the sooner that we go, the better. But again, I really want to stress, it can't be just overnight. We do have to give families some time to make the arrangements. And you all are probably a better judge even of that than I am, of what is the reasonable time for parents to make those shifts so that they are prepared. And I think our staff also needs a few days to be able to make some adjustments. So if the board approved it tonight, could we go virtual next week? Probably. I think we could probably do that. If we go on Monday, and the fact that we don't have a lot of spread in the schools, we probably could go Friday, which is what Santa Fe and Los Alamos are doing. So it just depends on what you think. But I do believe the spread is out there outside of the schools. Do believe it's going very fast based on those numbers. And I do believe that Dr. Mitchell has said that it's going to spill over to the schools at some point. Santa Fe and Los Alamos have decided to make it to the 20th. They have kind of a similar situation to us. But, there are no, you've all said it, there's no crystal ball. There could be something that changes that overnight. And we could have spread in the building tomorrow. We just don't know.
So and I apologize taking this up, but I'm looking at my calendar. So since they're off of school tomorrow for Veterans Day, and say we went 100% virtual on the 16th, that would really only give them 2 days.
That's correct.
So that probably would not be enough time if you're saying 3 to 5 days.
I think it might not be enough time.
Okay.
But I think 3 could be. And I've heard from folks I've talked to, 3 to 5 is what they'd like to have. But I don't think 2 is enough.
Okay.
But that's just a personal thing. I don't have anything to support that.
Okay.
Okay. So now we have a couple of dates. I think personally, I would like to try to make it to the 20th. I hate having to go into this anyway. But if there's a lot of the board that feels like we need to move on it sooner, we can do that. I'd like to hear from you all on that. If you feel like we need to go sooner.
This is Board Member Coleman. I don't believe that we need to go sooner. Granted, the decision might be made for us, but I just don't see at this point. I think really where the concern will be and where the focus really does need to be is after everyone has traveled. I think that with tomorrow being a holiday and things ramping up, that waiting until the 20th, I would be comfortable with that.
Is Jana on? Jana, did you want to talk to anything about kind of where we're going with this?
I am here. Hi, President Galbraith, Dr. Cleveland, members of the board. This is really hard to hear. So hopefully I don't get emotional in this. We've worked really hard to open our schools. We obviously care deeply and want our kids there, but we know that can't control a virus. We don't have evidence of huge spread in our schools. We've done a remarkable job. It is hard to manage the quarantine requirements that come out. And so as that's changed, it's been harder to keep staff in school. But I think we've done a remarkable job for students and family. And I would love to see our kids stay in school until the 20th if possible. As a group, we understand why we have to close if we have to close. We understand that. We know that there's health and safety at stake. The one ask from our principals is that if we do close, can we please have a reopen date? Can we make a commitment? And of course, if the virus is out of control, we can't have that reopen date. But if we could have a date that we know we could bring our kids back, we would greatly, greatly appreciate that, because we want to give them, we want them to know that we want them back, and we're going to get them back as soon as possible. So that's really the one ask if we do have to close, but we get it. We understand. We're very proud of everything the schools have done. The kids are happy. And I guess that's really where we are as a team. We talked about it today. So we understand, we respect the decision. Just ask for a reopen date in January so we can plan, if possible.
Thanks, Joanna. Go ahead, Dr. Cleveland.
That date was, but President Galbraith, could we have some of the other staff comment if they wanted to? I think having Beth Pendergrass comment, she's been the most involved in the community and working, with this and the surveys. And I'd like to give Beth and anyone else that really wanted to have a say, since you said you wanted this to be informal, this part of the discussion. So I would like Beth to have a chance, and then if there are any other staff members that would like to say something, I would like to give them a chance as well, if that's okay with you.
That would be wonderful. I would really appreciate that.
Beth, are you willing to make a few comments on how you see it and what you've heard, and add anything to this conversation?
Sure. I don't envy the board at all in this situation. It's very difficult. I think there's been a lot of discussion tonight about staff travel, but I don't want to lose either that we have a lot of families who plan to travel, and I hate this to be on staff only, because it's very few staff who would do that, and most of them have very good reasons that they would need to do that for. But however, we do have a lot of families as well that do plan to travel, that we've seen come in on the survey. And some of the concern we've had with that is the examples we've had of families not keeping their kids home to follow the quarantine rules after that. And we really have no way of tracking that. And so I just don't want to lose that piece as well. It's kind of, everyone's kind of involved in this, right? There's so many things to consider besides the travel as well, the situation that we're currently in, the quarantines. I'm very involved in having to quarantine close contact kids, and so I think a lot about that. And if we do have cases in the schools that we, most likely will have over the next couple weeks, I hate to make that call to the family and tell them that their kids are quarantined over Thanksgiving, especially if they're one of those families who plan to travel, and will they abide by that quarantine? Those are official quarantines. But I also hear from so many families that have truly appreciated having their kids back in school. And I have heard from principals and teachers who have enjoyed having the kids back in school. That's ultimately what we want. We want our kids in school. We want to be able to provide them those opportunities. We don't want the kids at home. We want to be able to manage the mental health issues and everything else. And the pandemic doesn't care about any of it, right? And that's the situation we're in. And I think it's a very difficult situation. So those are just some things that I want to make sure, that you guys hear again and consider. And I definitely don't want it, whatever decision we make, it's the pandemic that's the reason behind the decision that we make. It's not staff, and it's not families, and it's not, everyone plays a part in this, but really it comes down to, this is COVID, and so much of it is out of our control.
Thank you, Beth, for sharing that. We appreciate that.
Was there anyone else that would like to make a comment? I don't know that Billy's on this evening. Billy, if you are on, do you want to make a comment?
Don't see her on tonight.
She may not be here this evening.
She may jump on now that she's just heard her name. If she's
okay, well, it's not fair, because I certainly didn't let her know in advance that she might. I don't know. The only other person that might want to make a comment you've already heard from him once, but Mike Chavez certainly has a lot of interaction with staff, and might want to give you a couple of thoughts there. And then the other person I would really like to hear from, if she's willing to do that, is Tana and Joe, in terms of just what it's looking like. Every student issue goes through student services, and Joe manages every single student. And so she can give you kind of a feel, I think, for where we are at this point in terms of the numbers and the workload. But if you're not comfortable doing that, I'm not putting you all on the spot, but I want to give you a chance. If you want to share anything with the board, this would be a great time for you to do that.
Well, the only thing I'm really going to comment on, and I'm going to, I just want you to be aware that we have seen a significant rise in the number of people that we have been quarantining due to contact, and not in our schools, but out in the community. We have been getting report after report from staff members who are in contact with either family members or friends who are positive. And that makes a lot of sense. When you have 1,400 cases a day, people are going to come into contact. But we have been getting report after report and having to quarantine people because they report to us, oh, gee, I had dinner with a friend last night, and then he called me this morning and said he's positive. That becomes very problematic because, as I explained to you earlier, that person automatically has to be quarantined for 14 days. It's putting a significant dent in the number of staff members who are being out of our schools and being quarantined. The 14 days is a static number versus if you have a symptom and you can be back maybe in just a few days. But I will tell you, as Dr. Cleveland said, I'm also very concerned that it's just a matter of time and probably not very long before we see a significant rise in the school buildings of positive cases being reported and having to do quite a bit of quarantining and tracking and tracing. And as we've said, we've already closed 2 schools due to a lack of, staff members. So, again, it's, as Dr. Cleveland said, it's your choice, obviously. And it is, this has been the worst year. I've been an educator since 1994, guys. I've been a teacher for a really long time, and the last thing any teacher wants to see is schools with no kids. So this is certainly not an easy thing to live through. But on the other hand, I don't want to see any of our staff seriously ill or any of our children. So, but that's something I just wanted to tell you. We have seen just Monday and Tuesday of this week, we have been, there's no better word for it, we've been hammered with the numbers of people reporting to us that they've, and it's a significant rise in not symptoms, but people in contact with people who are positive.
Okay. Tana and Joe, do you want to make any comments? And then I saw that Elaine has come on. And so I would sure like to give her a chance as the union president to make some comments if she would like to do so. Tana?
Yes, and of course I'd like Joe to interject as well. I think one thing that we can all agree on is all of our staff are working super hard, and our nurses and Joe and Kim are having to, Kim Williams, our resource nurse, and Joe Sanchez, our nurse coordinator, are having to monitor cases all day long. And as of course they want to do it and they are doing it and they're happy to do it, it is very tiring, it is. And everyone's doing an excellent job. And even one of the other things that Joe has been working on is hiring for our care rooms. And this is a care room aide. And we are in a position, I believe we've hired 4 But correct me if I'm wrong, Joe. And so that's super exciting that we were able to do that, and the district was so willing to put those 11 positions for us to be able to hire. And so we have hired those 4 positions because we've been doing so great, but we absolutely understand the circumstances of what everyone has been saying about where we're at with the numbers in the state of New Mexico. So Joe, I'll let you go ahead and speak as well.
Thank you. I would like to say, I think first of all that so far I counted them today, I've submitted 21 positive student report forms. That's really not very many. That would be the total number of students in this district that have tested positive. And I see that as a really low number. And of those 21, not even half of them have had exposure beyond one person. So it's a very limited number of people that are being exposed by our students. They've just done a tremendous job. I guess my point is the provisions that we put into place are working. If we follow the rules, if we abide by them, we really are having a very low level of transmission within the schools, of course, but even among the students and their families. And I will say that for the most part, families have a symptomatic student, they keep that student home. And, so that contributes to the fact that we really don't have to quarantine very many students when we have a positive case, because their student was already out of school for a prolonged period of time and no one was exposed. So I just want to say I really appreciate the families and also the students that really, they have done a tremendous job. That being said, yes, we are tired. We do spend weekends submitting reports, quarantining students. I think the greater number, of course, are the staff that end up needing to be quarantined. And we don't have enough, we have enough nurses in all of our schools, but then if one school is closed because of a positive contact, that leaves a nurse out on quarantine. So you can see how it makes it difficult to staff all of the elementary schools. And then we also need to staff a care room separately from the health office. So that's a second person. And as Tana said, the district has created a care room aide position for us, which is fabulous. We have recommended for hire, but they're still in process. So that relief that we anticipate having from the care room aides is still not present yet. And we are short for health assistants. So, and those are in the elementary schools. So we need a care room aide just to replace the health assistants that are already, we're short. We're just not getting applicants for that position right now. So once we do get those positions filled, that will help tremendously as well. But it has been hard to find a nurse and a health assistant. We have been pulling nurses from the high schools and the middle schools and health assistants as well when they're available. So it has been a challenge to be available to cover everything every day where we're needed. But yeah, overall, I'm just really impressed with the amazing job that the staff and the nurses have done in protecting our schools and developing amazing protocols that are really working. They've done a tremendous job. So thank you.
Billy, are you ready to come on? Do you have, there you are.
Sure.
Hello,
Hi.
how are you?
So first I'd like to apologize for my appearance. I came home and got comfortable right away. I wasn't anticipating talking with you. So Board President Galbraith, Dr. Cleveland, board members, thank you for asking me to speak today. I really appreciate the opportunity to advocate on behalf of our staff. You know, we've heard a lot of concerns from staff about what's happening in the schools. We've expressed very clearly what's been said so many times tonight, that we don't have spread within the buildings. But with the increasing cases in the community, the staff are on high alert, and it's a very grave concern for staff. You know, in the state of New Mexico, we have one of the highest averages of employees and age in the schools. And because of that, it increases the risk for staff. And I would like to, you know, just tell you that, you know, it's amazing watching staff work. You know, the folks who are hybrid in the buildings, they love being there. They love being with students. I'm one of them. I teach in the classroom and I love being with my kids. It's so wonderful. But I'm very concerned for my own safety and the safety of my colleagues. I don't want to put someone else's life at risk because, you know, we're not being careful. I know you will be, and I've expressed that very clearly with the staff and with other resources. I've actually expressed very clearly, I know that you have our best interests at heart. And so my hope is that, you know, given the concerns for the community, we get it. We want kids in school. We all want kids in school, but at what cost? I think that's the message I would have. And I think that's the message that a lot of staff are concerned with. We definitely don't want to have a cost of someone's health or their well-being or their life. And so I, again, thank you for allowing me the moment to speak. And I apologize again for my disheveled appearance, but I'm always at the ready. If you ever need me, I'm always here. So thank you, Dr. Cleveland, for asking.
Is there anyone else of the staff that really wanted to add anything else? I think to Billy Helene's comment, I think we were concerned all along that the greater risk in terms of actually the virus might be the staff. Mike, how many do we have right now quarantined of our staff? Do you happen to know that number?
Dr. Cleveland, I'm sorry, off the top of my head, I do not.
Okay.
We have quarantined literally hundreds of people since we've gone into hybrid. Just last week, on Friday, we quarantined 28 staff members at Cleveland High School because of a positive individual that was at that school, and 22 Sodexo employees. So that just gives you an idea of how many we're talking about in some of these cases. And then on average, on a daily basis, we're seeing probably somewhere between 12 to 18 incidents a day. And as I said, a lot of those are becoming more prevalently close contact cases where individuals are reporting that they've been in contact with somebody who's a positive case. Initially, when the year started, when we went into hybrid mode, it was mostly people with symptoms, which was, you know, normal because people were having a lot of allergies and stuff. But now we're seeing a lot of people. We've had a number of positive individuals who were already quarantined. So thank goodness they were not in the building, so they did not affect other people. But I'm sorry, I couldn't even tell you right now how many we actually have out on quarantine. It's probably somewhere in the hundreds.
Do we have any idea of how many positives we've had? Positives.
Positive staff members, probably somewhere over, similar to what Joe reported, somewhere over 20 positive staff members.
Okay, thank you. So it goes back to what the recommendation is, and I think what you heard, at least what I heard, was the majority of the board would like it to be the 20th. And that we would let people know either now or no later than Monday, and that we would follow the same schedule as Los Alamos and Santa Fe, where we would return on the day after Martin Luther King holiday. And so I think that's what I've heard as the feeling of the majority of the board.
Yeah, I see Renee's on. Give Renee a second to.
Yeah, I'll be fast. The only thing that I would add at secondary, we have our small groups present, and I know we touched on that a little bit at earlier in the meeting. And I would just advocate that the decision that we make for the hybrid students, that be across the board. If it's not safe for everyone else, I feel like we should make sure and include those small groups also.
I'm just not sure that the state is going to allow that. So I think we'll have to see what the state allows, because the last thing we heard was that that wasn't an option for school districts if they were children with disabilities. However, I think to your point, it absolutely could be a possibility in terms of bringing back high needs students that are not children with disabilities. So I really appreciate you making that comment, because I think it's real important that that stays on the board's radar screen.
And we did have that conversation with Jerry Reeder. So Jana, Jerry, and I talked about that.
So Renee, I just want to make sure I'm understanding. So you're saying, so if we go into virtual, that those small groups should also go into virtual as well. Is that am I understanding that right? Okay.
Yes.
Okay, perfect. I just want to make sure I was on the same page. Thank you.
Okay, but please hear what I said, because I'm not sure that will be allowed for children with disabilities.
Yeah, I understand that. I just wanted to kind of make sure I was understanding what she was saying. But so for children with disabilities, we may not be able to make those changes as a whole, which is okay. So we lost Dr. Cleveland, I think. Are you still there? No, we lost Dr. Cleveland. I'm going to give her a second to come on. I think we're kind of to a point. Catherine, did you have something to say?
Yeah. So I think I'm prepared to do the 20th or even sooner. Because I think we're going to have more cases in the next couple of days that will be overwhelming, because we're just starting to see those figures. So I'm okay with the 20th, but also even sooner. And I do want, I guess, because just to clarify, because I want to make sure that people understand that I'm not, because Dr. Cleveland's comment and Beth's comment, I want to make sure that I'm not trying to make teachers or families villains whatsoever. I'm trying to clarify and understand that we really just don't have a choice at this point. So I hope I didn't come across that way to staff or teachers or anybody else, but I think that just trying to have a full understanding of what we were looking at. But at this time, I'm prepared to make a motion. I just want some feelings of what day. I know some are saying the 20th, but if we're going to see more increase, I think that a lot of the teachers should probably be prepared. They knew that this meeting was coming up. So I think most teachers are probably prepared within a couple of days' notice. So I'm even prepared to do it as a virtual starting next week, which I know everybody would probably hate me on that one, but because I think they're tested on Friday. Is that correct? They get you guys go do testing still on Fridays?
No, testing is on Wednesdays and the results come back on Friday.
Okay, thank you.
As I understood it.
And I think they were trying to change. Okay, so Wednesday,
Mike, do you want to
Friday,
clarify that?
by Friday, we may have more cases that from the testing from today. Okay.
That is correct. This week only, though, because we're closed tomorrow, we made arrangements with DOH to have testing on Tuesday and Thursday this week. So you're probably going to see, but you're absolutely right, President Galbraith and Noreen, Board Member Scott. We typically test on Wednesdays, which has been giving us results over the weekend quite a bit. I don't know about this week, to be honest. Their testing has been delayed significantly just because of the numbers of tests that are being run into Mexico right now. But I think DOH is still doing a pretty good job. I still have a lot of people who are sending me results within 2 to 3 days.
And so my thought is that we're probably going to be seeing a lot more increase because we're seeing the sheer volume of it going up daily. By the time they get the results, we're probably going to get even more. So then we're going to have more quarantined even next week. So
and I'm sorry, I don't mean. I was going to say I feel bad because I feel like I'm being Mr. Downer over here, but and I'm not. I'm really not trying to be. I'm just reporting to you guys really what we're seeing, but I do agree that and the good news is, and I'll reiterate what Joe said, I think as a district, we have done an amazing job. I have got to give so much credit to these principals, to these folks working in these schools, doing the right thing. I think we've done the right thing by being very conservative as a district, quarantining people and erring on the side of caution in every situation. Beth's department has been amazing, and in communicating so rapidly with people, and ensuring that people stay out of our buildings when there's any chance of this. It's just sheer numbers at this point, guys. It's just sheer numbers. That's all it is. 1,500 people a day is just overwhelming for anybody. So.
Thanks, Mike. Beth, I think wanted to add something real quick. Go ahead, Beth.
Yeah, it's super fast. I had a couple more comments from a couple principals that I just received, and one more from Billy that they asked that I just share with the board. The more time they have to prepare, the better. And so that was just a comment that I wanted to share on behalf of them. So thank you.
Thanks, Beth.
So,
yeah, I'm really inclined to that 20th if we're going to go. But is that what you're going to say, Noreen? Do you want to?
Yes, I was going to ask Board Member Cullen if she would amend her motion to be the 20th.
She didn't make one. Well, I haven't made a motion, but I'll be happy to make the motion to go ahead and suspend hybrid starting on the last day, November 20th.
So it would start on the 23rd.
Pardon me?
Yeah, so virtual would start on the 23rd.
So we are suspending hybrid last day on November 20th and restart January 18th. So
I think it's 19th.
19th. I had to look at my notes. And we start at January 19th. That is my motion.
And this is Board Member Coleman. I second that.
Okay. So we have a motion and a second. Is there anything else that anyone feels that they need to discuss before we go into the roll call vote? Okay. Jane, would you take a roll call vote on this, please?
Yes, I will. Vice President Morgan,
Yes.
Secretary Scott,
Yes.
Board Member Cullen,
Yes.
Board Member Coleman,
Yes.
Madam President Galbraith.
Yes.
Thank you.
Thank you so much, Jane. You know, and as we wrap up, as I know we have a lot of families who are watching right now, and if anyone else wants to say something real quick before we go, that's okay. And I know Dr. Cleveland, I'm sure, has a couple of remarks, but this isn't something that we want to do. And I'm glad that we have a January date, that we have something. I was getting a haircut the other day, and the woman that was cutting my hair, she's from Albuquerque, and she really wants to come to Rio Rancho because we are in school. And so I personally, and I think a lot of the board, from what I'm hearing, is that we want our students in school, and we hope that we can do everything that we can to get them back into school. That is where we want them to be. And we plead and plead and plead with our community to do those things that will help us to get our students back into school, because we truly know that that is what's best for the kids. We know that's what's best for the kids and for our families, is for them to be there. But we have a whole community that we also have to look at as we made this decision tonight. Is there anyone else on the board that wants to say something before I go to Dr. Cleveland? Yes, Noreen Scott, and then I'll go to Catherine Cullen.
I would just like to say that I voted with great reluctance, because I really would like to have our kids in school. And I am hearing throughout this meeting from people telling me, please keep us in school as long as you can. So I know this is painful for all of us. Let's hope we get through the holidays and that we've made the right decision. Thanks.
Yeah. Thank you, Secretary Scott. Catherine Cullen, I know you wanted to add, and then we can go to Wynn Coleman after that.
I did. I got to listen to Noreen, and I forgot what I was going to say. But anyway, but absolutely, I think that this is great reluctance for all of us. We want our students in school. We know how important it is, and I know that our community certainly wants them there. It's unfortunate that this is where it is. But we also, that was what I was going to say, is we also need to make sure that the schools are prepared to close down sooner if the governor comes out and shuts us down that earlier than the 20th, which could be. I mean, she could immediately say that Monday we're done. So I just want to make sure that even though we're putting this the 20th, obviously it depends on what the governor decides. I say tomorrow, but it's Thursday. So thank you.
Thank you, Catherine. Wynn Coleman.
Yes, and I do want to say that none of the board has ever taken a decision that we've had to make from our very first conversations about dealing with travel over spring break with students way back when that started. And I know that all of the board has taken this very seriously, whatever the decision has been made. I just want to say that what I've experienced firsthand, kind of how this has impacted, how COVID has impacted just personally circumstances. And what I want to do as a community overall is just be very aware of how proactive we need to be. And really, as I said earlier, really kind of look at the probability and kind of with everything we know right now, what we need to prepare for. So I appreciated Board Member Cullen's comment about being prepared, even though we have all voted on the 20th about being prepared, because we just don't know what might come down the road later this week. But I did just want to say to all of the community watching just how seriously we take this, and we are hearing from community members repeatedly during this whole entire time, really kind of expressing. So I just want to also say thank you to the community for their efforts to really kind of communicate their thoughts and their concerns as we have gone through this unprecedented time.
Thank you, Board Member Coleman. And then Jeffrey Morgan, did you want to say anything?
No, I'm fine. Thank you.
Okay, thank you.
Oh, you might want to let people know that we did read all their public comments too, because we did get a lot of them today. So we did.
And we did, and it wasn't on the agenda today because it will be officially on the agenda for next week, but we did, and I did sit down and read through those comments. We received almost 80, I think was the last that I looked at. And they're all over the place, just like they've been. I wish we all felt the same and that we could just, it would be so much easier to make these decisions. But we're all over on what we want. I personally, I have friends who I know are, they were so excited when their schools got put back in after being quarantined, the whole school for 14 days. And I feel for them doing this. And so I understand it's a really, really hard one for our families. Okay, so Jeff, I'm going to go to Dr. Cleveland if you're good. Are you good? Okay. Okay, Dr. Cleveland?
No, I'll just very quickly wrap up. I think a couple of things. I want to be sure about our language, and we need to be really careful when we talk about shutting down. There's a difference in shutting down and moving to virtual, and they are not the same thing. So we will be going back to virtual. We are not shutting down. It'll be going back. And
thank you, Dr.
We know that a lot of people don't want to go back, but we're not shutting down. So I want to be sure everybody is aware that we're not doing that. I think the second thing, I think we met all of the requirements. I think there's time for people to prepare. There's time for schools to prepare. There are no easy answers. One of the things I again want to thank everybody for all they have done to make this work, and a tremendous amount of time and effort has gone in, both virtual and in person. And I sure don't want to imply, and sometimes it sounds like, we're just applauding all those that are in person. Those that have been working virtually have been working very hard too. And we have to remember, many of our families chose to go virtual. That was their choice. That's what they wanted. And those folks have worked very, very hard. So it's everybody has contributed to making this work, whether you're in person learning or whether you're remote. I also, I didn't hear a lot of that. Thanks for those who are virtual teachers who have been willing to take on that role as well and have been virtual so that we can meet the needs of our kids and families who wanted that choice. So thank I just want to thank everybody who has made it work. And then my last comment is to kind of echo something Dr. Mitchell said, is there are things we can do as a community, and it's up to us to try to do that. And one of the things that Rio Rancho is really good about is in tough times, we pull together as a community and we make a difference. And so we're in that situation again, and there's a lot of things that we can do to make a difference. And then reminding everyone, including us, including our staff, that we've got to, I forget who said it, we've got to follow the rules. And we've got to take every precaution we can to protect ourselves and to protect the others that we work with. And so thanks to everybody for their tremendous hard work. It has been amazing. It's been an incredible effort. And we're going to continue that effort as we stay in remote for a little while, and then hope that we'll come back out of it in January. But again, some of that is up to us in terms of our seriousness in fighting the pandemic. And again, nobody asked for this. Nobody wanted this. Nobody thought we would ever be here. But we're going to make the best of a really bad situation and do the very best that we can. And my last comment is just a thanks to parents. We've heard from so many of you. And in the survey, well, there were certainly a lot of suggestions for how we could improve, lots of positive feedback. And I just can't tell you how much that meant to the staff. Or talk about how hard their teachers were working, or how hard the custodians were working to keep the building clean, or all of, how much the counselors and nurses were doing to try to ensure a safe environment. So to the parents who wrote those things back, I just want to let you know how very powerful they were for the staff. And we thank you for that. And for those who sent suggestions and criticisms, I want you to know we've heard those too. And we will use those to become even better. But we have no magic wands here. Wish we did. But thank you all for your continued help and support of the district.
Okay. Thank you, Dr. Cleveland. And just one last thing, I just want to say about our superintendent, Dr. Cleveland. She truly fights for our students. She fights for our families, and she fights for our teachers and our administrators. And I have a lot of opportunities to meet with Dr. Cleveland as we go over agendas and talk about what's going on in the district. And she's an advocate for our school community. And I want to thank her for all that she has done and speaking up for our district as she goes into meetings. Anytime that she can have a voice, she makes sure she's voicing, on behalf of our families. And we truly appreciate that, Dr. Cleveland. Thank you for all that you've done on our behalf, and for the leadership that you've shown us in these your whole career, but especially during these last few months as we've been going through this.
President Galbraith, I second that. Thank you, Dr. Cleveland. And thank you to our really quality staff and our teachers. And I agree, our community has got to pull together and get through this, and we'll come out on the other side much healthier and much better off.
Thank you, Secretary.
And I want you all to know that your support during this time has mattered a lot. No, you all didn't sign up for this, and neither did we. None of us knew that we were going to be facing this, but thank you for your support during this time as well.
Okay. Thank you, everyone. Is there anything else from any of the board? I'll just look over. Okay. I know it's been a long night. I appreciate you giving your time to this. It was a big decision that needed to be made. And so I really appreciate the board for being here, and all of our staff and all the support staff that has been able to be here tonight. Thank you. For advanced planning, we do have a meeting this Monday, November 16th. It's a regular board meeting. It will be live streamed for those who wish to watch that meeting. And with that, our meeting for tonight is adjourned. Thank you all again.
Thank you.